Hello, my name is Sean Sung Park. I'm a prosthetic urologist practicing in Seoul, South Korea. My practice is more specialized into the inflatable penile prosthesis for the past, over 10 years. Today, I'm going to talk about why we surgeons need to understand how to do the anesthesia when we do the surgery. System in South Korea is a little different. In here, I'm a private practitioner, and if I want to do the surgery, I have to prepare everything necessary for the surgery. My own OR staff, my own equipments, my own sterilization, everything. So that the surgery can go right. That includes anesthesia. I started to do the inflatable penile implants with the local anesthesia, which is quite unusual for the so-called Western countries, including US. Most of the cases, they do through the spinal or the general anesthesia, and the patient is fully knocked off. They can't remember anything throughout the surgery. But for us, there were some other reasons. I kinda started to do the penile implant with the local anesthesia. At first, it was a lot of stress. The patient was awake, and sometimes local anesthesia is not a complete pain-free procedure. Then I adapted the other adaptive anesthesia methods, like light sedation, to make the patient feel much comfortable. So over the courses, I had to do the anesthesia myself. For the difficult cases or the revision cases, I had to invite the anesthesiologist to the spinal anesthesia. So that's how I was doing, but I was not happy with the spinal anesthesia results. So I asked my friend and went to Germany to learn the spinal anesthesia, came back and has been done a little more of a year with the spinal anesthesia now. Then why am I saying that we surgeons need to understand anesthesia? Because generally what happens is that in the tertiary standards, like university hospitals or the big hospitals, the setting is that we surgeons don't touch with the anesthesia. Anesthesiologist comes in, they do the spinal, they do the general, and then they prepare the patient for us to do the surgery. What really happened with me is that as I was doing the spinal and as I was doing the local anesthesia, I can understand the extent of the anesthesia that we need to do. What I mean by that is that sometimes we don't have to put that much of anesthesia on the patient to do this type of surgery. Anesthesiologists are not surgeons. They don't do the surgery. Hence, they watch the surgery, but they can't really understand how much anesthesia a patient might need for the specific type of surgery. Not always. So usually, the way they do is a much safer way, which means they put a full anesthesia, like let's say heavy anesthesia, so that the patient might never have any issues with the pain. At the same time, this is more for the surgeon, so that the surgeon can perform the surgery without difficulties. I mean, when it comes to drugs or when it comes to procedure, we try to minimize the invasiveness with our surgical techniques. Why don't we apply the same toward the anesthesia as well? But to apply that, surgeon needs to dictate how much anesthesia I want or I need with this case. If the surgeon doesn't understand the method and the extent of the anesthesia, or if they are able to control it, they can't really dictate or request what the anesthesiologists need to do. This is the reason why I personally prefer to do the anesthesia myself, because I know the extent of the surgery, and that's how I can adapt. By doing so, I was able to tailor the amount of the anesthesia patients will get. Do we really need to cover the post-operative pain? Then we can manage the drugs according to that. Do we really to minimize the anesthesia's time? Then we can modulate the drugs so that the patient doesn't have to stay longer than they need to. And when it comes to penile implant, it really worked well, because as I was modulating the drugs and those anesthesia method, after all, the goal of the surgery is patient satisfaction. I think the experience of the surgery itself is also very important. Patients shouldn't suffer. If we can really minimize the suffer, and if we can really help them to have a better experience of surgery, isn't that what we should think about? So in terms of that, I think surgeons really need to pay more attention to the anesthesia method as well.